This is CCTA case number 36. This is a 64-year-old man who was status post-coronary bypass surgery who's had an abnormal stress test suggesting anterior and inferior wall ischemia. This is a 10-phase study to look at his overall left ventricular size, shape, and function. I've placed the images into the standard short axis, horizontal long axis, and vertical long axis phases. Let's take a look at the function by hitting the Cine Control play button. You can see here that there is dyskinesia of the left ventricular apex, seen both on the horizontal and vertical long axis views, as well as some akinesis involving the inferior septal region at the mid-ventricle. Let's take a better look at the ventricle by stopping this, hopefully near end diastole, and take a look at overall size. I'm going to expand here the horizontal long axis, and we're going to take some measurements in terms of size. Let's bring up the menu here, two-dimensional menu. Let's look at left ventricular chamber size. Measures approximately 58 millimeters. Upper limits of normal is 55, so this is mild left ventricular dilation. I'm also going to switch to a thinner MIP here by going back to the full menu and switching from a 5 millimeter MIP to a MPR view. Let's bring that back up into the expanded version. So let's look at the apex. As you can see here, there is some darkening of the left ventricular apex compared to the perfusion in the septum and the lateral wall. This is consistent with a prior transmural infarction. Finally, when you look at the apex, it should scallop out here, sort of look like a football, if you will. But you can see there's some flattening in these regions here at the apex, and this is of concern for a possible left ventricular thrombus. So in this man who's had a prior bypass, he has clear evidence of a prior apical transmural myocardial infarction with apical dyskinesia and some akinesis involving the inferior septal regions of the left ventricle. Finally, he may well have a laminated left ventricular apical thrombus. If this cannot be confirmed, then further evaluation, including echocardiography, may be appropriate to further evaluate this area.